Hi, this is Robin McConkey Ward. I'm your instructor again for FHS 1500 Chapter 2. And Chapter 2 is about heredity and genetics and things, but I thought we better first talk about the assignments that will be due from this module or this chapter. So in your section from the home page, if you click modules on the left side, in Chapter 2, it's a thing called concept exploration. It's kind of like the old essays where you just, I'll show you. Okay, it's have a conversation with someone about a concept in the chapter. So you look through the chapter and see if there's a section that kind of is interesting to you, or something that a friend is going through, or if you have no one to talk to besides the dog, you could go on Copilot and then select something like a short passage or something that you can quote that's kind of the interesting part to you. I'd like you to record the conversation and then attach it to your to the assignment, and then write about the experience when you were talking with someone. There are more details. There's a rubric and everything in the assignment section. Let me show you the rubric. Okay, you get 5 points for adherence, in other words, following what the assignment told you to do. And then up to 5 points for like insight, thoughtfulness, that you actually care about the topic that you were talking about. And the chapters are pretty long, and so you probably will be able to find something that's interesting to you. And then from 0 to 5 points that you've submitted each of the parts into your Office 365 folder. And so those are the types of things that we're looking for with that assignment. You don't have a concept exploration for each chapter, but every other chapter. And so you'll need to be careful and look in the modules to see which ones, which chapters you actually have them for. The others you'll have a discussion and case studies, which I'll talk to you about when we get to that point. Okay, so let's jump in to Chapter 2, which is really a fun one. Of course, I know I say that for all the chapters, but the heredity, prenatal development, and birth. If you haven't gone through pregnancy and birth, this might be full of interesting things. If you've gone through it, then you kind of already know. Heredity is passing traits, obviously, from parents to offspring. There are physical traits, there are behavioral traits. Obviously, your physical traits are, eye color, your risk for diseases, how tall you're going to be. There are a couple really fun videos on YouTube. I'm sure you could go to YouTube and search something and find it. There's these sisters that do videos that I really like. I think there must be science teachers or something, because they really know what they're doing. They're called the Amoeba Sisters, and there's a section in YouTube on DNA, chromosomes, genes, and traits. And if you're struggling a little bit with this, or you just need a little refresher or something, they're really a good, fun way kind of to go through this. One of the fun things that I like is that they don't always point out things with humans. Sometimes they explain things through in this video, like snakes and stuff like that. So it's kind of just fun. And if you're teaching, if you hear these weird noises in the background, I'm out of my backyard where it's usually really, really quiet, and it's not really quiet. So if it gets too noisy, I'll go inside like that. Oh well. Chromosomes are organized into units called genes. And you can see the picture, and that's a picture taken from an electron microscope. I imagine AI has a lot to do with that. But genes are specific, like nucleotides and things like that. And then chromosomes are the genetic material that is transferred, the genetic information. And genes are passed down from generation to generation. We know that. Each person has half of his or her genes from each parent. That's why you take certain traits that make you look, act, behave more like one or the other of your parents. There's another really good YouTube video. If you want to stop and write that down and watch it later, that would be great. If not, if you feel pretty comfortable with genetics and genes and all that type of stuff, we don't get into great detail. Okay, the next section talks about genotype and phenotype. And the genotype is your genetic inheritance. What are your genes, which is called genotype? What are your genes giving you from each of your parents? So a genotype is like the sum of all of the genes that you inherit. And then the interesting section to that is the phenotype, is your physical appearance. In other words, what is observable? And the phenotype is influenced by the genotype. Okay, so if we look at this picture of this white tiger, his genotype is what? So think for a sec. All of the genetics that are inside this tiger that make him what he is. And the phenotype is what you can observe. So you probably would observe that he's a white tiger, but he still has the tiger stripes, but he's not an orange tiger because he's a white tiger. Wow, that was really deep, wasn't it? All right, if we just, I don't think there's anything on your quiz about twins, but I just thought it was fun to throw in. My husband is a twin, and I have grandsons that are twins. And so this is kind of just an interesting thing. Monozygotic twins are one egg is fertilized and it splits into two identical parts. And it's really hard to tell until the kids are a little bit older if they're really identical or not. Fraternal twins are called dizygotic because they are two separate eggs that were fertilized by two separate sperm. So they have as much genetic likeness as other siblings. They just happen to share the same womb and come out at the same time. Okay? So none of that was on your test, but this part probably will be. We talk about prenatal development. If you flip in your book to 2.6, we've skipped a couple of the sections. Not that you shouldn't read them, but if they're not going to be tested, I didn't see a great need to put them in here. The germinal period is right after the fertilized egg. Well, let me just do this. The first 2 weeks after fertilization. Okay. If you have not seen The Miracle of Birth, which if you're in nursing, you've probably seen it 100 times already. It is interesting. There are different versions of it, but if you haven't seen it, you probably ought to go and see it because it gives you all the details that you need. And at this point in your life, you probably could use to know some of those things. Okay, the thing I found really interesting is once the egg is fertilized, it starts dividing until it gets bigger than 8 cells, divides into 8 pieces. All of those cells are stem cells, and they're all the same as each other. So if you're going to do stem cell research or pulling a stem cell off, you would have to do it in this early stage. Once the egg implants, which means it attaches itself to the side of a woman's uterus, it happens about 10 days after conception. So in the first 2 weeks, it's been fertilized, it's traveled down the fallopian tube, it's been dividing all this time, and then it implants itself in the side of the uterus. If it does not implant, it'll just pass out, and it'll pass out of the body, and you probably won't even know that there was a fertilized egg traveling around there. Okay, the embryonic period then is the period after that, from 2 to 8 weeks. Now, if you notice, you don't usually know that you're pregnant by this time. You may have some morning sickness and things like that, but meanwhile, the embryo is developing all of its body systems. It's a really critical time, and all the systems need to have nourishment and be healthy. And what do you know as far as are you pregnant or not? You might have little inklings, but probably pretty not. And so how you're eating and all those types of things are really important. I saw a commercial on that says everybody should be taking prenatal vitamins at this stage of your life if you're possibly, if you could possibly be pregnant. Because by the time you know you're pregnant, all the body systems have all been put together. Cephalocaudal means the head will develop first. And so if you look at pictures and things of pregnancy and babies inside the womb, the head is always big, and that's because it develops first. Therefore, anytime you think you might be pregnant, there should be absolutely no alcohol consumption at all. We have the problem with fetal alcohol syndrome, which is where the mother has been drinking a lot while the baby's systems are forming, and the baby turns out to have all sorts of issues because the alcohol got in the way of when they were developing. So this is 2 to 8 weeks. So again, you are unaware. The fetal period is 9 weeks until birth, and it's the longest period, obviously. All your body structures are formed by 8 weeks. And so if you remember, all that's left to get going are the sex organs. You can even see little toes and little hands and fingers and things at this age. They need to grow a lot. Their sex organs, of course, and the hormones will begin. The age of viability is when the little tiny baby might be able to survive. It's usually 22 weeks is the age of viability, but then they have to have proper brain development with that. It's very difficult on little ones to try to survive if they don't have the full term within the womb. Not that they can't, but they have all sorts of difficulties. If we look at the birth itself, you can see the pictures that pregnancy usually lasts 38 to 40 weeks. Of course, it's not an exact science, the day that that when the baby will be born, unless you can plan that with your doctor. There are 3 stages of birth. First, the cervix starts dilating, and that's when all the pain with labor comes, where the muscles are forcing or the hormones are forcing the muscles to open up and be able to let this baby out. The next stage of birth is when the baby's actually coming out. And then there's the 3rd stage of labor, which is placenta expulsion. Most babies are born head first. Some are breech, which means they're born with their feet first or their bum first or something. It's amazing that with all the births in the world, not very many things go wrong. But when they go wrong, they seem to really go wrong. One of the most interesting things that I've seen when I've watched live births, which are fascinating, by the way, if you don't think of what part of the woman you're looking at, but anyway, is the placenta. The placenta is the sac around the baby that the baby lives inside. the whole time that they're inside the mom. It provides the baby with nutrients and it carries away the waste. Um, the placenta is actually considered a temporary organ, and it is delivered out of the mom with contractions and everything in the third stage of labor. And one of the things that the doctor does first is after the baby is born, and the nurses will take the baby and do the testing, which we'll talk about in a little bit. And the doctor will deliver the placenta, and then they check that placenta to make sure that there's no little parts left. Now we have an airplane going overhead. And that there's no little parts stuck in the woman's uterus, because that can cause infection and all sorts. So here's a picture of a placenta. It's pretty interesting. It's pretty ugly, but all sorts of things. One of the interesting things, this part is not on your test, is what happens after the placenta comes out. Well, you can do different things. By default, the hospital will dispose of it, treat it as like biomedical waste, and incinerate it. You can choose to donate it, and people will use the tissues for scientific research or make skin grafts with it for severe burn victims. They're coming up with like wonderful things to do. You can put it in a stem cell bank, which you arrange ahead of time to have this private service come and harvest and freeze the blood from the placenta and the umbilical cord if you might need it for future medical use. Some families choose to keep the placenta, maybe like cultural or personal practices. You bury it in a special place, or you plant a tree over the top of it as a living memorial. And there are some people that pay companies to dehydrate it, powder it, and put it into capsules for people to ingest. I don't know, but to me it's interesting, all the different things they can do. Okay, during pregnancy, there are some harmful substances, and they're called teratogens. And they're just environmental agents that can harm the prenatal development, the development of the baby. The first 3 months are when the most harmful things can happen because they're developing so much. Again, why is alcohol so harmful? You know, some people like to do the weekend drunk thing, and if they're pregnant, that all goes through to the baby. So my suggestion, doctor's suggestion, stop drinking before you try to have a baby. Not just drinking, but other things too. This chart is a really interesting one. They have tons of them on the internet in different types, but it shows you this is all inside during pregnancy. This is what the fetus and the embryo look like as they're growing, week 3, 4, 5, 6, blah, 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 blah. And you can see which things are growing at that time. So this is when your heart is developing, week 6 through about week 3 to about 6 or 7. And then this is where it's finishing up kind of thing. But if something happens during this time, it can really affect the heart. During this time are the arms and legs. If you remember, I'm sure you don't remember, it's a long time ago, in the 50s and 60s, where women took thalidomide so they didn't have morning sickness. But if they took it at this certain time, then their babies had deformed arms and legs. And then if they took it before then or after that time, they didn't have the deformities. So there's all sorts of just interesting things you can look at. After the baby's born, they immediately will assess the baby for health to see if there's something they need to do. They do it at 1 minute and 5 minute intervals, and they give them an APGAR score. Anoxia is they're checking for lack of oxygen. Okay, and they test heart rate, breathing, muscle tone, color, and reflexes. On each thing, they score 1, 0, 1, or 2. A score of 10 is perfect, 7 means they're okay, and if it's less than that, then they need to go through and see what medical intervention that the baby needs. This is an APGAR scoring chart that just says what each thing stands for, and if you get 0 points, 1 point, or 2 points. And they do that super quickly, and it really helps to know if the baby needs help right away. Then they can go do the medical interventions that they need. It assesses their physical condition. I already said that. And it helps answer the question, is medical intervention needed? They just need to clean the baby up and wrap it and, give it to the mom and dad, or do they need to go take care of something that the baby's missing? Okay, so that's chapter 2. It's not extremely long, but it's super interesting. So come back for chapter 3 when you're ready for that. Thanks.